Ever feel like you could use a crash course in, well,
Yeah.
That's kind of the vibe I'm getting from intensive therapy for substance use disorders.
Yeah.
It's not just your average therapy session,
Yeah.
right? Like, it's about diving deep and getting to the core of these challenges.
Right.
Today, we're going beyond those once-a-week chats on a therapist's couch. We've got research papers, clinical insights, even some firsthand accounts to really understand what makes intensive therapy tick. So, ready to ditch the small talk and unlock some serious self-knowledge?
Let's do it.
Let's do it.
What intrigues me is how intensive therapy kind of flips the script. It's less about venting about problems and more about equipping you to handle them, like a pro.
Yeah, pro being the key word there. I'll admit I pictured something intense like therapy on fast forward.
Right.
But our sources paint a more nuanced picture, right? It's not just about speed, it's about the depth and breadth of the approach.
Precisely. Imagine a therapist who knows your history, your triggers, your deepest fears, all because they've had the time to truly understand your journey. That's the power of intensive therapy's structure.
It's like the difference between reading a book summary and really savoring each chapter. You get a richer, more complete understanding.
Mm-hmm.
Speaking of understanding, let's break down the key differences between this and traditional therapy. Our sources point to some pretty clear distinctions.
One of the biggest distinctions is the sheer amount of contact. Instead of a quick check-in once a week, imagine multiple sessions, even daily ones in some cases.
Wow.
And these aren't your typical hour-long appointments either.
No kidding. We're talking 90 minutes or more. So instead of a quick, how was your week? It's more like, let's really unpack the events, thoughts, and feelings that shaped it.
Exactly. This allows for a level of exploration and self-discovery that simply isn't possible in shorter sessions. It's like the difference between skimming the surface of the ocean and actually diving down to explore a coral reef. You uncover so much more detail and richness.
Love that analogy.
Yeah.
And it's not just the quantity of time, it's how it's used.
Right.
Our research on CBT, cognitive behavioral therapy, highlights how intensive formats can condense weeks or even months of work into a much shorter time frame.
That's right. Imagine someone battling social anxiety. In a condensed CBT format, they might practice real-world scenarios, receive immediate feedback, and refine their coping skills all within a single intensive week. The accelerated nature can be incredibly empowering.
It's like boot camp for your brain, retraining those thought patterns and behaviors.
Mm-hmm.
But it's more than just a mental workout, right? Intensive therapy also takes a holistic view, addressing the physical, emotional, even spiritual aspects that impact recovery.
Absolutely. Take relapse prevention, a key element in intensive therapy. It's not just about willpower. It's about equipping individuals with healthy coping mechanisms, stress management techniques, and a support system to navigate those challenging moments. It's about building a fortress of resilience.
A fortress of resilience, that's a powerful image. So it's not just about fixing the problem, it's about building a new foundation for a healthier life. But what does this actually look and feel like for someone in the midst of it? Can you walk us through a typical session in an intensive setting?
Picture this. You're in a calm, supportive environment, maybe a residential facility or a dedicated outpatient center. The longer session allows for deeper exploration. Imagine uncovering hidden emotional patterns, addressing relationship dynamics, or even processing past traumas that have been fueling unhealthy behaviors.
Wow, that level of introspection can be incredibly powerful.
Mm.
It's like finally having the time and space to address those deeply rooted issues that traditional therapy might only scratch the surface of. It's like finally having the time to connect the dots, to understand how those past experiences might be influencing your present struggles.
Yeah.
Our research highlighted the importance of tailoring treatment to the individual. It's not a one-size-fits-all approach.
Exactly. Intensive therapy shines when it comes to addressing those unique factors that contribute to substance use. For someone battling severe addiction, for instance, the structured environment of inpatient rehab can be life-changing.
It makes sense, right? Like 24/7 support, medical supervision if needed, a break from the triggers and stressors of everyday life.
Right.
That kind of intensive intervention can be crucial in those early stages of recovery.
Precisely. And for those with co-occurring disorders, think substance use alongside depression, anxiety, or trauma-intensive therapy provides the bandwidth to address those interwoven challenges in a holistic way.
It's like treating the whole person, not just the symptoms. Which brings to mind a question about those varying levels of care. Our sources mention that intensive therapy isn't an all-or-nothing proposition. It's more of a spectrum, right?
Absolutely. The American Society of Addiction Medicine, or ASAM, actually outlines 5 distinct levels of care, each with its own intensity and structure. It's about finding the right fit for the individual's needs and circumstances.
Okay, so picture a ladder with 5 rungs.
Okay.
Can you walk us through those different levels, especially the ones where intensive therapy plays a key role?
Absolutely. Let's start with intensive outpatient programs or IOPs. They're a step up from traditional outpatient therapy, requiring more hours per week, but still allowing individuals to live at home and maintain some aspects of their routine.
So still going to work or school, but also carving out dedicated time for therapy and recovery-focused activities.
Exactly. IOPs offer a blend of individual therapy, group sessions, and often specialized tracks for things like anger management, relapse prevention, or family therapy.
It's like a choose-your-own-adventure in recovery,
Right.
tailoring the experience to your specific needs and challenges. Our research suggests IOPs can be incredibly effective, even comparable to inpatient rehab in some cases.
That's right. They provide a structured and supportive environment without requiring the same level of disruption as inpatient care.
Got it. So what about those situations where someone needs even more support than an IOP can provide? That's where partial hospitalization programs, or PHPs, come in.
Exactly. PHPs are the next rung up that ladder.
Okay.
They offer even more structure and intensity, with participants typically attending for several hours each day, multiple days a week.
So more immersive than IOPs, but still allowing individuals to return home each night.
Precisely. PHPs often incorporate a wider range of therapeutic services, including individual therapy, group therapy, medication management, even things like art therapy or mindfulness practices.
It sounds incredibly comprehensive, almost like a buffet of therapeutic options.
That's a great way to put it. It's about providing a holistic and individualized approach to recovery.
I'm starting to see why they call it partial hospitalization. It's like bridging the gap between intensive outpatient care and that full 24/7 support.
Right.
Which brings us to the top rung of our ladder, inpatient rehab.
Inpatient rehab is where intensive therapy truly takes center stage. Imagine a dedicated facility where recovery becomes your sole focus, 24 hours a day.
No work deadlines, no household chores, no everyday stressors to navigate. Just a chance to really dive deep into the work of healing and building a solid foundation for lasting sobriety.
You got it. It's about providing a safe, structured, and supportive environment where individuals can break free from the cycle of addiction and develop the skills and insights needed to thrive outside of treatment.
Our research touched on how vital that transition back to real life can be. That's where the real test of intensive therapy's effectiveness comes in, right?
Absolutely. It's not just about staying sober within the confines of a treatment center. It's about equipping individuals with the tools and support system to navigate the challenges and triggers they'll inevitably face when they return home.
So it's like intensive therapy plants the seeds, but it's up to the individual to nurture those seeds and cultivate their own garden of recovery, so to speak.
I like that analogy because it highlights that intensive therapy, regardless of the setting, isn't a magic bullet. It requires commitment, hard work, and a willingness to embrace the process.
Our sources were very clear on that point. Intensive therapy is a partnership. It's about the individual and the therapist working together, side by side, to achieve those recovery goals.
It's about empowering individuals to become active participants in their own healing journeys, to find their voices, and to build a life they truly value.
So as we wrap up our deep dive into the world of intensive therapy, what's the main takeaway you hope our listener walks away with today?
If there's one thing I hope you remember, it's that intensive therapy offers a path to accelerated, comprehensive recovery support. It's about digging deeper, addressing the root causes of substance use, and equipping individuals with the tools to not just survive, but to thrive.
It's about giving yourself, or someone you love, the gift of focused time and expert guidance to truly heal and reclaim their life. And listener, if you're wondering if intensive therapy might be the missing piece in your own recovery puzzle, remember this. It's never too late to reach out for help, to explore your options, and to embark on your own journey of healing and transformation. Until next time, keep diving deep.